As an audiologist at Bluegrass Hearing Clinic, I'm often asked what medical conditions contribute to hearing loss and balance dysfunction. So some conditions are diabetes, heart conditions, autoimmune conditions, and genetic disorders that can present in kidney problems and vision problems. When you come in for an appointment, the audiologist will sit down and ask you some questions about your medical history. Oftentimes patients say to me, well, nothing that contributes to my ears. Well, sometimes it might not directly affect your ear, but underlying medical conditions can actually contribute to additional issues with hearing and balance that you might not know about. It's important to see an audiologist or a licensed hearing instrument specialist before you go and obtain a hearing device, because you never know if there's an underlying medical condition that's contributing to your hearing loss or your balance problems. An example that I've come across is I had a patient who was really struggling to understand speech. And during the hearing testing, I noticed a lot of delays when they were trying to respond to any speech cues, and I referred them to a neurologist, and it came back they had multiple sclerosis. So you never know if something else is going on that's causing you to have a hard time understanding people, or maybe you're feeling a little bit dizzy, that could really be impacting your other areas of your life. Recently, I had a patient come in, and during case history, they reported they had recently been diagnosed with kidney problems. When I looked into their ears, I noticed that their ear canals were vertical. Those are red flags, the kidney issue and the vertical canals, for something called bronchio-otorenal syndrome. After testing, that person was also diagnosed with hearing loss. Putting those symptoms together made me decide to refer the patient back to their primary care physician for a medical genetics evaluation to determine if they had bronchio-otorenal syndrome, so they could get evaluated by other specialists and inform their family members as well, so they can be tested for the same condition. That's why at Bluegrass Hearing Clinic, you have a comprehensive hearing evaluation with one of our providers that includes a thorough assessment of your medical history to determine if you have any underlying medical conditions that we need to refer out for before we fit you with a hearing aid.